Healthcare professionals, first responders, and many who are eligible in the territory are now receiving their second dose of the COVID-19 vaccine. It means medical facilities are preparing to receive more doses and make it available for a larger portion of the community. USVI News' Ali Bourne-Vanek meets with medical professionals in St. Croix who share how the vaccination process works.
The medical team at ProHealth Urgent Care in St. Croix are completing the second round of the COVID vaccine. They're ready to move forward and serve the community.
Today I received my second dose. I feel perfectly fine. I've had no reaction. I've had no complications. I feel very well. And certainly I'm a first responder, so obviously it's very important for me to protect myself, protect you, protect the patients that I confront. And therefore I was obviously first in line, just like every other healthcare provider that has to deliver care to other patients.
Dr. John Charles Perez is the medical director for ProHealth. He took the Pfizer vaccine and reports he feels great.
We're looking at a pandemic that is not slowing down anytime soon. And I can, as being one of the first here in the Virgin Islands to receive my Pfizer vaccine, can attest that I had no symptoms, no complications, no soreness, no any type of reaction. 1. 2, just received my second vaccine today, and again, no reaction, no complication, feel like $1 million. Now, having said that, everything and anything is possible with any kind of anaphylaxis and so forth. We haven't seen it, and we've actually vaccinated several of our employees, our healthcare providers, and none of us have had any kind of reaction to date. And so therefore, what would I share with you? The same thing that the professor from USF shared with me just last week. Wherever, however, whenever you can have access to receiving your vaccine, please do.
The facility opened last March and is equipped with the refrigeration needed to store the vaccine.
We were one of the first, I guess, to receive the vaccinations. We do have our refrigeration. For Pfizer, as you know, it's different than Moderna. You have to have a certain type of refrigeration for it, a certain type of refrigerator, which we have here on island. It's actually in store right now, and so that's why we'll be able to have on hand much more doses of vaccines. We'll have our own refrigeration to store even more.
This freezer is about to be certified to hold as many COVID-19 vaccines as possible. And let me tell you, this is cold, minus 70 degrees.
Dr. Tricia Harris is the operations manager for ProHealth Urgent Care and is taking her second dose of the COVID vaccine. She shares how education is key when it comes to the vaccination and welcomes any questions patients may have.
Number one question, should I take it? Or did you take it? Or why should I take it? So that's it. I mean, I think it's more, the fear is coming from unknowing. People don't know enough about the vaccine. It's too soon. It's too quick. You know, how did it develop? What are going to be the long-term side effects? And that's probably the number one answer. What is the long-term side effects? It hasn't been enough time. It was literally created in less than 12 months. What people don't know is that 70,000 people have already been vaccinated with 2 doses just from the clinical trials alone. And so once they're educated and they have more information to know that this didn't just pop up overnight, that a lot of thought has gone into it, a lot of things through the CDC and the FDA to prepare this vaccine to give to the general public, healthcare workers, have been in the working for a while.
So far in the USVI and nationwide, the vaccine is available to first responders, healthcare workers, immunocompromised, and those over 65. Dr. Perez emphasizes that it's important to not miss the day you're supposed to take the second COVID vaccination shot.
Very, very important to follow protocol and don't break protocol. If you received your vaccine today, make sure that in 21 days you get your second vaccine. I don't care where you're at in the country. If you have to fly back to where you first started, you have to fly back. Don't break protocol. That was again reminded to me by my good professor. Do not break protocol. Make sure you receive it exactly 21 days from the first one.
In St. Croix, Ali Bourne-Vanek, USVI News.